Glowing Star. Welcome to the future of medicine, Glowing Star. Imagine a world where diabetes is no longer a lifelong struggle. Recent groundbreaking scientific advancements are revolutionizing the way we approach this condition. DNA sparkles. Through cutting-edge treatments, researchers are unlocking the potential to restore the body's natural ability to produce insulin. This could mean a life free from daily injections and constant monitoring. Join us as we explore the science, the innovation, and the hope behind these life-changing discoveries. Together, we're moving closer to a cure. Lightbulb flexed biceps. Stay tuned for this exciting journey into the future of healthcare. 1. Stem cell transplants. In a significant advancement for regenerative medicine, a 25-year-old woman with type 1 diabetes has successfully undergone a stem cell transplant that could revolutionize diabetes treatment. The procedure involved converting her own cells into insulin-producing islet cells, which were then transplanted into her abdominal muscles. Within just 3 months of the transplant, the patient began producing insulin naturally, eliminating the need for daily insulin injections. This marks a remarkable achievement in the field of diabetes research, as type 1 diabetes is characterized by the immune system attacking insulin-producing cells in the pancreas, leaving patients reliant on external insulin to regulate blood sugar levels. The innovative approach utilized by scientists underscores the potential of stem cell therapy in addressing chronic diseases. By using the patient's own cells, the risk of immune rejection is minimized, making this method a safer and more personalized treatment option. The ability to restore natural insulin production offers hope for millions living with type 1 diabetes, who currently manage the condition through rigorous monitoring and frequent injections. While this case represents a major step forward, further research and clinical trials will be necessary to determine the long-term efficacy and scalability of this treatment. If successful on a broader scale, this breakthrough could pave the way for new therapeutic strategies not only for diabetes but also for other autoimmune and degenerative diseases. This promising development highlights the transformative potential of regenerative medicine and reinforces the importance of continued investment in medical research. For patients with type 1 diabetes, this advancement brings renewed optimism for a future free from the burdens of daily disease management. 2. Combination drug therapies. Recent developments in diabetes research have unveiled a groundbreaking approach to restoring insulin production. Researchers are now exploring the combination of Harmina, a compound known for its ability to regenerate insulin-producing beta cells, with GLP-1 receptor agonists such as semaglutide, a well-established treatment for managing blood sugar levels. This innovative combination has demonstrated remarkable results in preclinical studies, showing a 700% increase in beta cell mass. Beta cells, located in the pancreas, are critical for producing insulin, the hormone responsible for regulating blood sugar levels. In both type 1 and type 2 diabetes, the destruction or dysfunction of these cells leads to impaired insulin production, resulting in chronic health complications if untreated. Harmina works by promoting the regeneration of beta cells, offering hope for reversing the loss of these crucial cells. Meanwhile, GLP-1 receptor agonists like semaglutide enhance insulin secretion and improve metabolic function. Together, their synergistic effects could revolutionize diabetes care by not only managing blood sugar levels but also addressing the root cause of the disease. While these findings are still in the experimental stage, they represent a significant step forward in diabetes research. If successful in clinical trials, this combination therapy could provide a transformative solution for millions of people living with diabetes worldwide. Experts remain cautiously optimistic, emphasizing the need for further studies to evaluate long-term safety and efficacy in humans. Nonetheless, this pioneering approach underscores the potential of combination therapies to tackle complex diseases like diabetes from multiple angles, offering renewed hope for improved outcomes and quality of life. 3. Cell therapy innovations. A groundbreaking medical advancement in cell therapy has shown promising results in the treatment of type 2 diabetes, potentially paving the way for a new era in diabetes management. The innovative procedure was recently performed on a 59-year-old man in Shanghai, who had been living with the chronic condition. The therapy involved transforming the patient's own blood cells into insulin-producing cells. These modified cells were then transplanted back into his body, effectively restoring his ability to regulate blood sugar levels. Remarkably, within just 11 weeks of undergoing the treatment, the patient no longer required daily insulin injections, a routine that had likely been an integral part of his life for years. Even more impressively, after a year of monitoring, the patient was able to discontinue all diabetes-related medications altogether. Medical evaluations confirmed that his pancreatic function had been restored, marking a significant milestone in diabetes treatment. This achievement is particularly noteworthy given the progressive and often irreversible nature of type 2 diabetes, which affects millions of people worldwide. While the therapy is still in its early stages and requires further clinical trials to assess its long-term safety and efficacy, the results from this case are undeniably encouraging. If proven viable on a larger scale, this approach could revolutionize how type 2 diabetes is treated, offering patients a potential alternative to lifelong dependency on medication and insulin therapy. This development highlights the growing potential of regenerative medicine in addressing complex chronic diseases. It also underscores the importance of continued investment in cutting-edge research to explore new frontiers in healthcare. For now, this case serves as a beacon of hope for patients and medical professionals alike, signaling that a future free from the burdens of type 2 diabetes may be within reach. 4. Experimental procedures. A groundbreaking experimental treatment has demonstrated remarkable success in helping individuals with type 2 diabetes reduce their reliance on insulin. The innovative approach combines a technique known as RECET, recellularization via electroporation therapy, with the use of the medication semaglutide. According to recent findings, 86% of participants undergoing this treatment were able to discontinue insulin therapy while maintaining stable blood sugar levels. RECET is a novel procedure that uses electroporation, a process involving electrical pulses, to promote cellular recellularization in targeted tissues. When paired with semaglutide, a medication already approved for managing type 2 diabetes, the combination appears to provide an effective and less invasive alternative to traditional insulin therapy. The results are particularly significant for individuals seeking to move away from daily insulin injections, which can be burdensome and costly. By maintaining glucose control without insulin, this treatment could enhance the quality of life for millions of diabetes patients worldwide. While the findings are promising, further clinical trials and long-term studies are necessary to fully understand the safety and efficacy of this approach. If proven successful on a larger scale, this therapy could mark a major advancement in diabetes care, offering new hope for those managing the chronic condition. And that wraps up this incredible journey into the latest advancements in diabetes treatment, proof that science is bringing us closer to a brighter future. The dedication to curing this condition offers hope to millions, but the road ahead still requires rigorous research and testing. If you found this video insightful, don't forget to give it a thumbs up and share it with others who might benefit from this knowledge. And for more updates on groundbreaking medical developments, hit that subscribe button and join our community. Together, let's stay informed and inspired. See you in the next video.